The topic of today is related to how technology is being used during this crisis. And, and as any technology, it can be used in a positive way and in a malicious way. The positive way, the good uses of technology have to do with several different technology. First of all, the most obvious one is the use of technology to sequence the genetic code of this virus. Just to give you an idea, in just 1 month, once the virus was detected, we were able to recreate the genome sequence of the virus. To compare with SARS in 2003, it took more than 3 months to do it. Why was it important? Because once the genetic sequence is known, researchers can start to work on the virus. They can recreate synthetic samples, but they can also share the knowledge about how the virus spread and also try to trace and monitor this virus. Artificial intelligence has played an important role in sequencing this virus, but also for other uses, for diagnosis. AI can read thousands of MRI and CT scan in a few seconds with high levels of accuracies. And also, our era is characterized by the creation of lots of data, and AI is really good for going through all this data to help scientists also to cooperate and develop new cure for this disease. AI also helped in minimizing fatality and optimize disease management. AI was used for developing testing devices, and in the future, we might be using AI to predict epidemics. Not just AI played a role, but drones have been used as well for surveillance purposes, but also for informing citizens about area that they would have to leave, or to remind people not to leave their homes. Some companies are also using drones for delivery purposes. Robots have been used, notably in China, to deliver food, medicine, and other supplies to patients, as well as to help people working in hospitals. 3D printing has been used to develop masks or spare parts for masks. Our mobile phone, as well as our computers, have been used extensively for connecting us together, to provide company with e-services, business continuity, for students to be able to learn online, for the medical people to be in contact with the patients, but also for all of us to be able to socialize. These good uses have also been counterbalanced by bad uses of this technology. Especially in the field of cybersecurity, we have seen a rise in hacking activities, especially targeting people who are the most vulnerable. Most people in times of crisis will lower the guard in terms of the information that they consume, as well as the hygiene they have when it comes to the cyber hygiene. And we've seen attempts at phishing, at social engineering, even targeting hospital, which is quite dramatic. Espionage also been used through cyber security means, has been reported that governments have tried and used this time also to spy on other governments. One of the most important negative uses that has been noticed by the United Nations is the rise of the spread of disinformation through what we call infodemic, which is the ability to provide a lot of misinformation or disinformation and rumor about a specific crisis that basically overwhelmed the good information. And finally, the use of surveillance, which is good for tracking the virus, also run the risk of being used afterwards. And this raises ethical concerns into the safeguards that we should put in place in order not to favor more authoritarianism in the future.